my name's Beck and I'm the gynaecology nurse here at Eve Health. You'll probably see me before or after your surgeries, or you'll hear my voice on the phone. So I basically just help the doctors with any inquiries from you guys and any minor procedures that we do in the clinic here at Eve. I got into nursing after observing and seeing all the influential things the women in my life have done through nursing. So my mother, grandmother and great-grandmother were all nurses, and just seeing all that they had achieved in their careers as nurses just really pushed me to become a nurse and pursue that career. And particularly in women's health, it's always been a great passion of mine, and I hope to continue pursuing that, and I can do that here at Eve, and I absolutely love it. It's so hard to choose just one thing I love about nursing. Of course, I think every nurse really loves, just caring for patients and knowing that they're making a difference. But the thing that I love the most, especially being in women's health, is just seeing how we can, here at Eve Health, really help women empower themselves and see some really fantastic outcomes and make their lives better. If you asked me this question in January of this year, I would have had a totally different answer. The role of the nurse has always been such an important part in the healthcare system, and even more so now with COVID-19. I think a lot of what nurses do has really been emphasised this year and has really been put out there to the population, with them being on the front line, being essential workers and putting in the extra hours and extra effort for everyone to make sure that Australia is safe. So really they are the worker bees this year and making sure that everything is running smoothly. With this year being celebrating the Champions of Change, reflecting upon all of that and everything that I have learnt from my granny, my mum, my great granny, their experience of nursing definitely changed over time from what they had told me and compared to what I do now. It's important to see that the role of the nurse isn't just static. They aren't just making beds and changing bedpans. We are now helping to manage patients' chronic illnesses. We are educating patients, and we are just such a great asset to the healthcare system, to the doctors, to all the other healthcare professionals out there. And that's forever going to be changing as our population changes, as our population ages and lives longer. And it is something that's just inevitable and going to keep on happening, which is just fantastic for nurses. And it's fantastic that we're able to expand our knowledge and have so many opportunities to do more things and just work on a ward, which is great, and you learn so much. But then you can also work in a clinic, you can be working research. There is so many different options as to what nurses can do these days, which is just fantastic.